Okay, I think we can start. It's 3 p.m. and I would like to welcome you all to our webinar today, Enabling Nature-Based Health and Social Care through Knowledge Alliances. My name is Colm O'Driscoll and I'm here today wearing two hats, the first of which is as International Project Development Team Leader for ETIFOR, Valuing Nature, and the second as Connecting Nature Sustainable Forestry Community Ambassador. Before we begin, I'd very briefly to present the agenda, and we have a wonderful panel and series of discussions lined up today. The opening session is composed of so 3 presentations running from 3 to 3:50, and the topic will be on the role of green care in society, so setting the foundation for the panelist discussions to come. The second session will essentially speak about more specifically market perspectives in policy, and run from 3:50 to 4:50, after which there will be a break. And the final panel will go more in depth looking at specifically practice, so nature-based therapies for prevention. So we'll kind of try and cover 360-degree, let's say, coverage view of green care, nature-based solutions for health and well-being from policy to practice. Okay. Before we start, I'd like to maybe get us thinking a little bit about, you know, what brings us here today. And to do that, I need to think about what brings me here today. And two of the, I guess, the fundamental things that bring me here today, and maybe some of you all today, is a love of, I might be as bold to say as a love of nature, all things green, and the possibility of combining that to do more for people who don't have access to that, or the possibility to benefit from it, maybe the way some of us do, or the knowledge of that. So green and care. But not only, we may also be here for the possibility for opportunity. Curiosity might bring us here, and personal interest or research interest or professional interest. And not only, also connections bring us here, and nature bringing us back to the green again. So this love for nature. So when we speak about opportunity, we also think another important word maybe I'm leaving out here is sustainability. And I think when we want to speak about putting all of these teams together in our own professional research and innovation interests, we consider how we can do this in practice, and we can do this through the research and innovation projects that many of us are involved in, whether it's in professional activity or otherwise. And certainly from my own personal experience, there are some projects that have stood out over the years more than others in setting the foundation research and innovation practices. And one of these, unfortunately, I was involved in was EcoStar, which paved the way, laid the foundation for this project that you will be introduced to today, Green4C, and a future project as well, UForest. And not only, as we say, some of the words that popped into mind as why we are here today include also connections and connections with nature. So another incredible connection was the connection between this incredible platform, Connecting Nature, and the 3 realities that I've just mentioned: EcoStar, Green4C, and UForest. So when we speak about trying to give sustainability to our research and innovation, we need to do this through creating these connections, bridging these links among research and innovation to give a better impact, a more long-term and sustainable impact to the work that many of us carry out. And do this then, if we do this successfully, we may also be able to attract possibly new finance, new investment to give sustainability to these great projects and platforms that we create. And not only through these connections, we also make new connections, and some of these connections give further sustainability to the work that we carry out. So I'd like to stop there, but before we continue very quickly, I'd just like to say that in the two projects that we're happy to focus on today, more specifically the international launch of Green Care, which is one of them, Green4C. We have two platforms for which, if you want to delve a little bit deeper into these aspects, you can join both the Green Care platform. Each of these platforms have different functions. Green Care is much more specific to individual entrepreneurship exploration for practitioners, supporters, providers of these aspects. But then there is also the Connecting Nature platform, which is more specific to nature-based solutions, so buyers and suppliers of nature-based solutions. And you can join both of these platforms, and we have the great possibility today of being able to bridge these two realities in the hope of seeking out and reaching something more sustainable with the solutions we identify. Thank you very much. I'm going to stop there, and I'm going to introduce Ricardo, facilitator for the day. And I'll give the floor to Ricardo now, who will explain some more technical aspects of the activities we'll be involved in during the course of the sessions. Thank you.
Okay, thank you very much, Colm. I'm here just for technical support. In this webinar, we consider some parts for questions. I kindly ask you to join us in slido.com, and entering with this code, you can address your question to the panelists. We share this now, even also during the first part with the keynote. We will not have so much time to answer questions, but all the questions will be redone during the second part. We ask you to address your question, specifying the name of the panelist to whom you want to address the question, and then you ask the question. In Slido, you can also vote the question of the other participants, so we will address only the question with more votes. So thank you so much, and enjoy the webinar.
Thank you, Ricardo. And I just saw a quick question there. We would prefer that all questions are directed specifically to Slido, that the chat should only be used for specific technical problems. We also, unfortunately, only have the keynote speaker for the beginning of this first session. So any questions, most voted questions directed at the keynote speaker, Matthias Braubach, we can follow up with him later for any of you who wish to pose your questions to him, but he will not be, unfortunately, able to answer the questions at the end of the first panel, when the questions and answers section will take place. Without further ado, I'd like to give the floor now to Professor Davide Pettinella from the University of Padova and the scientific coordinator of Green4C. Davide, please. And you are on mute there, Davide. Just to unmute, thank you.
Thank you, Colm. Can you see my slide?
Yes.
Perfect. Thanks. I'm Davide Pettinella, and I've been invited to introduce a topic of Green4C with special reference to the role of the forest sector. How I'm going to organize my presentation? Well, we'll speak about some global trends and strategic options that the forest sector is facing these years. Then I will concentrate on describing 3 dominant policies affecting the use of forest resources. And I will finish with one concluding remark. So let's see which are the strategic options affecting the forest sector. Recently, a very interesting document has been published by the European Commission. Is this report that you see in the slide, the Strategic Foresight Report. And in the reports, 10 open strategic elements have been underlined. It's interesting to note that the first one is dealing with ensuring sustainable and resilient health and food system. Only to spend a few words about the contents of this point of this chapter, you see that the European Union healthcare system should include investment in innovative care models, strengthening the healthcare workforce, focusing on preventive measures and addressing comorbidity. So this is a clear message. The first, the priority in the challenging elements for the strategic vision of the European Union is connected with health and food system. This is a starting point for our discourse on which can be the role of forest, which can be the policy for enforcing this strategy. I think that there are three dominant policies influencing the use of forest resources: the One Health policy, the New Green Deal policy, and the ecosystem services provision policy. Of course, among these three policies, there are synergies and also trade-off. Think to the case of the relationship between One Health policy, New Green Deal policy, when we are speaking about urban forest mitigation of heat waves. There are also synergies between the One Health policy and the ecosystem service provision policy in the case of the control of forest-based zoonosis. And there are synergies between New Green policy, New Green Deal policy, and ecosystem services provision policy in connection with the fire prevention. And finally, there are even cases of overlapping and integration and synergies between the three options of policy, to the case of green soft tourism. Of course, we have also conflicts and trade-off. And one example also in relation to the overlapping area between the three policies is the problem of use of biomass or wood biomass for energy. But let we try to give a definition and understanding a bit better the relationship between dominant policies. One Health policy, a policy that has been developed by many institutions, starting and with the primary role of the World Health Organization, is a policy based on the idea that human health and animal health are interdependent and bound to the health of the ecosystem. This means that we have to create a collaborative global approach, understanding and reducing risk for human, animal, and ecosystem health. So strong connection, of course, also between the forest environment, forest resources, means the ecosystem health and quality, and the human and animal health. The New Green Deal policy is a dominant policy oriented to all the sectorial policy in the European Union. Here you have an overall picture of all the sectorial policy that are connected, and they are under the umbrella of this European Green Deal approach. And among the different policy, I think it's worthwhile to mention that in the strategic documents that have been presented in the last years, there are quite a lot of very interesting references to the role of forest in providing service for human health. Here you see in page 1 of the European Union Biodiversity Strategy, this quotation: nature is as important for our mental and physical well-being as it is for our society ability to cope with global change, health threats, and disaster. We need nature in our lives. And also in the most recent new European Union Forest Strategy, there is a reference to the issue of health, of human health. forest and the forest-based sector provide multiple social economic function and benefits, including additional jobs and growth opportunities in rural areas and recreational function, contributing to the citizen physical and mental health. And as a proof that human health is much connected with the use of forest resources, here you see a summary table of a survey that we have done analyzing the 26 national recovery and resilience plans approved by the European Union member states. And we have classified all the activity connected with the forest and wood, and at least 5 of them are connected with the topic of human health in green spaces, in green environment. And as you can see, quite a lot of countries are investing some of the resources, of the financial resources of the National Recovery and Resilience Plan in this sector. About ecosystem services protection, this is a definition that, of course, is referring directly to the biodiversity protection policy, to the climate change, and to the policy for the use of renewable energy. Here, I would like to frame the role of the green care activities in the forest within the logical frame developed by the ecosystem, the Millennium Ecosystem survey. And in this famous publication, we have the well-known definition in 3+1 categories of ecosystem services. The third one is the category of the so-called cultural ecosystem services, referring to aesthetic, spiritual, educational, and recreational services that are fundamental elements of the constituents of well-being, of the elements of our well-being. What do we mean for cultural ecosystem services? I would prefer to call them socio-cultural ecosystem services, a larger set of services, from cultural service, poor cultural services, to educational service, sport, spiritual, tourism, social inclusion, wellness, and therapeutic treatments. We are concerned today with the concept of green care. Well, green care is a broad concept, by sure dealing with the problem, the issue of wellness and therapeutic treatments, but also with social inclusion, in some way also with tourism, recreation, and other services. A definition of green care, I think, may be useful. Green care is an emerging concept referring to a range of activities that promotes a physical and mental health and well-being through contact with nature. And the green care, forest green care, urban care, social green care tourism are the 4 areas of work of the Green4C project supported by the European Economic Commission through the Erasmus Plus program. Let's have a comparative view of these 3 groups of services in order to better understand the role, the importance of the socio-cultural services, and in this way of the Green4Care services. Well, if we link in a bit simplified view of the ecosystem services economy, these are 3 categories of services to institution drivers, we can underline that this is a link between market and provisioning service, state regulating services, and the community and socio-cultural services. Are more precisely the prevailing instruments, while of course in the case of provisioning services, think to the case of wood, prices and free market economic mechanism are the most important instruments. For the regulating services, compensation, incentives, eco-taxes are playing a very important role. In the case of socio-cultural services, we are speaking about technical assistance, people engagement, local authorities mission, entrepreneurial support. And another way, if we refer to the background economic theory supporting the analysis and the development of these three groups of services, we see this strong link between provisioning services, neoclassical economics, regulating services and environmental economics, or if you want, neo-institutional economics, and the socio-cultural services with social economics. What do we mean for social economics? Social economics is a branch of economics and social science that focuses the relationship between social behavior and economics, covering such issues as social capital, gender, ethics, and philanthropic behavior. You see how radical is the difference in the approach, in the tools, in the background of the socio-cultural services in relation to the provisional and regulating services. I will finish with one concluding remark. Of course, in setting the foundation, we cannot avoid mentioning the role and the lesson that we're learning from the COVID-19 experience. COVID is helping us to give evidence to the importance, need of the state as a regulatory authority for an active welfare policy. But in the same time, the COVID experience is teaching us that having different working conditions is not only feasible, but is convenient for the health of employees. The importance of a continuous approach and use of green areas. And finally, a third important lesson is about the role of social relations. They are important drivers of the quality of the life. While all these three new evidences coming out from the experience of the COVID are supporting green care in terms of a relatively low-cost solution, much based on small-scale activities, frequently connected to non-profit organizations, to the so-called social economy, inspired by values of solidarity and social inclusion. Green care services are based on natural resources, and with an increasing use of these natural resources, it's possible to give them higher social values. And at the end, we turn out to have natural resources starting from forests that are more protected. And finally, green care are associated to labor-intensive solution in a context where we are facing various problems of unemployment and raising social inequality. Let me only remind you very quickly about the problem of the rising of inequality all around the world. As a consequence also of the pandemic experience, a problem that is affecting also Europe, of course, a problem that can be described using a lot of indicators. You find one of these indicators that are telling us that maybe we are not really driving our society, our economy towards a just transition. The number of billionaires worldwide that has been increasing a lot in the last years. I finish here stressing the fact that green care is a useful tool for building the ecological transition, taking into consideration that most of our problems sorry, are due to the excess of resources and a misallocation of them. Thanks a lot.
Thank you. Very interesting, Davide. Thank you very much. Indeed, it's evident that the forestry and environment sectors are aware of the positive spillovers that nature has to offer. I think it's also important to understand if health institutions and the public health and private health sector are beginning to understand or be aware of these. Hopefully, we'll see more and more of this awareness come to play as time goes on. Indeed, maybe to shed a bit more light on this, at the moment we have from the World Health Organization, focusing more specifically in urban green spaces, Matthias Braubach, who's going to give us an overview of the position there. Matthias? Okay. When you're ready, Matthias.
So I hope you can see my screen.
Yes, I can see your screen.
All right. Thank you very much for the introduction. As introduced, I will have the second set of 15 minutes to open this event, looking more into the health relevance of urban nature. And I think it makes a nice connection to what has been introduced before by David. So I'll be telling a little bit about our work on the urban nature and the links to health. And before going into details, I would like to start with a macro view on the situation we're currently in. And everybody knows that the rise of the population has been coupled with the rise of use of natural resources. And that gets us a rise of environmental problems, be it water shortage, ocean acidification, loss of tropical forest. And all these things have been increasing. And you also know that we have records for this for sometimes 100 years and more. But this all brings us into a situation where we have a loss of diversity because of the way we deal with nature. And also here you can see that we're only collecting data, we're only knowing about this since quite a few decades. And since then it's heavily going down. So to start with, any type of nature is an added value in any type of setting. And if you want to have some more information about the natural dimension of health, how biodiversity links to health, you have two ways to look at it. One is using a huge report published some years ago on biodiversity and health, which has hundreds of pages giving detailed knowledge, or you can go to an overview document, Nature, Biodiversity and Health, which the WHO has published just a few months ago and is much lighter reading, but also much less in detail than the other book on the left side. So with this little introduction, I would like to focus on the main theme of the presentation. I will present the work that we have been doing at the WHO Office on Environment and Health, on urban nature, specifically on urban green space and health. One of the main objectives of our work was to derive key messages, especially for urban practitioners that are really in the daily business of maintaining and providing and managing the green spaces and the urban nature. The first work we did was asking ourselves, what do we actually know? What are the impacts of nature and urban green space specifically on health? We started with a review of evidence, and it gives you, for example, one of the discussions of different levels. We were looking at the different green space characteristics and what are their impacts on our life. How do we use green space? What settings do we live in? And here we go back to what David said before. What are the environmental services that they provide to us? How do they impact us and our life? And that gives different pathways how green spaces can affect health, be it individually through the physical environment or social environment, population health as a group, or getting to you individually. And then at the end of the day, what are the outcomes? What is the impact that nature has on our health status and our well-being? And we can divide that into physical health, into mental health, social well-being, and as David mentioned before, also the issue of inequalities plays a major role. So that is what we will focus on a little bit today, but it's not going to be a medical lecture, but more putting things in context. So there are different ways how urban nature and green spaces can affect health. And I would like to sum up these pathways into 4 different dimensions. The first is that nature provides a wide range of environmental benefits. For example, the reduction and the buffering of urban heat, flood mitigation through nature and nature-based solutions, and of course, the impact on air quality and filtering, cleaning air pollution is, I think, not the full set, but probably some of the most important environmental benefits to consider. The second dimension would be the direct benefits that nature has for human beings. One example would be noise buffering. It could be the exposure to diverse microbiota, so it gives you a consistent training to your immune system. And also, not to forget, UV exposure. We don't want too much sunlight, but we do need sunlight. And being out, getting some sunshine is a very healthy thing, if in adequate doses. Also, David has referred to social benefits. Social interaction often takes place outside in public and nature space. Community cohesion is supported by public space, often with a natural context, and also the promotion of physical activity alone, but also in groups, we have categorized into this benefit section. And finally, the mental benefits, the psychosocial well-being is also supported and linked to nature, be it through enhanced nature connection and out in nature and deriving benefits from that, or stress reduction and attention restoration. And I think we all know that if you have a busy day at the office or at work in general, staying in this context and trying to take a break is difficult. But getting out into nature, going to the park, going to a river makes a huge difference and will help people to restore attention and capacities and reduce their stress. So these are 4 different pathways how urban nature can affect health, and each of them takes place at a daily basis, more or less. Another thing that the report of WHO on the evidence review did was to put together an indicator how to measure access to green spaces. And just a few weeks ago, an interesting study was published on green space and mortality in European cities that has looked at the implication of that indicator, taking it as a recommendation by WHO on access to green spaces. So this is the first study we are aware of that estimates the annual number of deaths that could be prevented if European cities and greater cities in general, achieved the WHO recommendation for access to green space. And for our indicator, how to measure it, WHO recommended that a green space of at least half a hectare size should be accessible within 300-meter linear distance of a residence, which makes up roughly 5 minutes of walking. The study found that meeting this recommendation could prevent a little bit more than 2% of the natural cause mortality, so roughly 43,000 deaths daily. It found that the distribution of green space is very different between the cities, and therefore the mortality burden that could be prevented ranges from 0 to a little bit more than 5% of all deaths. So the 2.3 is an average, and you have more or less prevention capacity in different cities, depending on their green space situation. It shows that some of the European capitals have a very high level of mortality that can be attributed to lack of green space. And of course, putting even more green space into urban settings beyond the recommended level would, and making it closer to people, would of course help to even prevent more and more strongly the number of deaths. So that was a very strong information and evidence we got some weeks ago, applying that indicator methodology as a recommendation. Having all that evidence compiled, we then looked into how do we actually achieve health protection through urban green spaces, and we looked into green space interventions and how effective they are. So on the one hand, we did an evidence review on green space intervention, but we also at the same time had a European case study collection on local projects to invest in green spaces in urban settings. And we had a large variety of case studies from small to large parks and playgrounds, expensive and very low budget, in institutionalized settings outside in parks. So there's a wide range of different things that were contributed as case studies. And one of the most interesting things was, one of the questions asked to the case study contributors was, what was the main objective for doing the green space intervention? And you can see that the main objective and the secondary objective of the intervention usually related to maximizing the urban environmental benefits. This is the most important objective. And then follows promoting lifestyle, active lifestyle, allowing people to be out in nature and getting out, being physically active was the second most objective for doing these interventions. Then interesting also, the social equity and environmental justice was quite relevant as well, to make sure that different neighborhoods in the city had at least not extremely bad green space situations. So focusing on those neighborhoods that were deprived in that context. But only very few said, oh, well, we basically put more green space into our city because we wanted to reduce health impacts. So health is always integrated in all of these green space objectives mentioned before, especially, I guess, with promoting active lifestyle, but it is usually not spelled out as a specific objective that is trying to be achieved. So then we put the two reports on the evidence and interventions together, and we created a few years ago the WHO Urban Green Space Brief for Action that puts in a nutshell a lot of information for local authorities how to make sure that they put adequate green spaces to promote health. And this is available in a range of different languages. Just to give you some example, there will be information in that action brief on how to design healthy urban green spaces. There's information on how to target different communities and have stakeholder community engagement to make sure that green space in the city really respond to the needs of the local residents. And I think it's extremely important that we also have included a section on the potential challenges and conflicts of green spaces, because green space can also be a danger. It can have unintended side effects. If we talk about gentrification in a social context, if we talk about vector-borne diseases, if we talk about injuries, if we talk about conflict with different users of green space because they have very different objectives, what they want to do in the park, that all is covered in that document. And I would like, similar to David, also make a quick detour to the COVID implication and how it relates to nature, especially in large cities like Berlin. And this is data from Google looking at where people are during the first lockdown in spring last year. And you can see that we have not only been less shopping and less at the office and less using public transport, we also have been much less out in green spaces and in parks. More than 60% of dropped presence and attendances to parks were recorded in Berlin during the first lockdown. And it led to discussion, what is the value of parks during the pandemic? Should we keep parks open? Do the benefits outweigh the risks? And how do we make green spaces still available, observing all the pandemic restrictions and rules of social distancing? So there was a very new look at the health impact of green spaces. And in that context, I would like to quickly refer to two different studies done on green spaces during the pandemic. The one is an international online survey from Spain, which reached 6,000 people across the world. They looked into nature exposure and the impacts during the pandemic by having a distinction of the lockdown severity and how restrictive the measures were, whether people had still, despite the restrictions, access to outdoor spaces like private spaces and courtyards, or if they at least had natural view from the window and they could see green space and nature from the house. And what they found is that during the COVID pandemic and during the lockdown, depression and anxiety went up. The more severe the lockdown was, the stronger the restrictive measures were. And at the same time, depression and anxiety went down and was compensated if people had accessible outdoor spaces and natural elements that they could see from the window. So that's quite an interesting finding. And it unfortunately is in conflict with another study from the UK. I shouldn't say in conflict, but it's an interesting connection that if we look at the socioeconomic groups, we can see that low socioeconomic groups with lower income are much less likely to have access to a private garden, to a yard or a balcony. So the environmental inequalities we have in terms of access to green space, where we usually think about going to a park, have been even amplified and more relevant during the pandemic, because it really deprived people from that opportunity. And only if you had something privately or from the window, you had access to it. And this is socially very unequally distributed. And this is not only the case in England. I would just like to highlight quickly, urban nature includes more than just green space. There's also a project recently on blue health and the relevance of blue spaces. I will not have time to go into that in detail. So if you're interested, you can look for the Blue Health project and its toolbox, which will give you a lot of information on the health impacts of blue spaces as well. I would like to conclude, and I think here also I link to what David said before on the green care. This is, I think, the biggest link that my presentation provides to green care. If nature were a pill, it would be reimbursed by healthcare insurance, because it has so many impacts, positive impacts on well-being and mental health, physical health, social impacts, physical activity and relaxation, and managing stress. So it is something very important. Green care is definitely an important way to look into population health, and we need to simply ensure that it is available locally and for all residents equally. With this, thank you very much. And I'm sorry, I won't be able to stay until the end of the whole event, so I won't be able to take questions. But if there's questions that can be forwarded, I'm happy to answer them later by email. Thank you.
Thank you very much, Matthias, and we will get back to you if there are any questions. Just 2 points in relation to what you've just presented. One is that we have 2 experts from the Blue Health Project on the panel today as well. So if there are questions in relation to blue space and blue health, we have and blue care, we have experts and they will be introduced later. And also that last statement, I think, is very powerful, and it's very much connected to what we've been trying to explore a little bit in the next presentation. So if nature were a pill, I guess it's up to all of us to make it a pill. And I think that we have the knowledge here to do it, and we also are beginning to understand that there's a market for it. And with that, I'm going to leave the floor to Rick de Vries, the coordinator of Clearinghouse and team leader of the European Forest Institute urban forestry team. Okay, Rick, the floor is yours.
Thank you, Colm. Do you see my screen?
Yes, I see your screen, Rick.
The classical question. Thanks for the introduction, and also thank you, Matthias, for your nice introduction. We stay in Bonn. We are in office life, we are kind of neighbors. The European Forest Institute is sharing together with the United Nations and with other international organizations, we are sharing the United Nations campus in Bonn. So let's go and have a look on the market which there is for green care interventions. So we have seen all, Davide and Matthias have introduced all the things, the good benefits that nature provides to human health and well-being. So to paraphrase what Matthias has been saying, if nature would have been a pill, it would be reimbursed. But the question is, if you're working with nature as a green care practitioner, will you be able to market this? Will you be able to make a living? So for this, we have been doing an overview of the green care market in Europe. With I'm presenting this here on behalf of lots of people from the Green4C project team. So big thank you to all of you who have been contributing to this, but also a big thank you to all of you who have been contributing through interviews or through filling out a survey throughout the previous months. I've noticed we have some of our interviewees in the panel, or in the public, sorry. So we have been looking into these 4 sectors in green care, going from the left to the right, the forest-based care, green care, tourism, urban green care, and social agriculture. And of course, this division is a bit, how to say, virtual. Some companies active in social agriculture also have forest holdings or are working together with tourism operators, for instance. So the question that we tried to answer is, how has the market been developing and how develop in the future? So there are 4 different reports published. I will provide you the link later on, and maybe the colleagues can also paste the link into the chat. So there are 4 different reports, also 4 different approaches. Because this market is overall quite young, and also lots of small companies in this market, so it's quite difficult to get figures. So we have been using surveys, we have been doing interviews, focus group discussions, and in-depth interviews, and also we have been working with, and especially particularly for the urban green care market outlook, we have been working with the outcome of the Naturevation Horizon 2020 project, who have been developing a very nice initiative, the Urban Nature Atlas, which is including well, more than 1,000 initiatives working with nature as a nature-based solution. We have selected 50 of these initiatives, which are focused on providing benefits for public health and well-being. Very much in a nutshell, these are the outcomes of the market outlook. Some of the initiatives are already quite old. For instance, green care tourism. Well, this is a very old market indeed, because it also includes wellness. It also includes the spas, that already have been used by the Romans, for instance, for their health benefits. But it also includes these locations where people were going in the beginning of the industrial times to get clean air, to breathe clean air. Also, for instance, tuberculosis, people who had tuberculosis were sent to this kind of, how to say, intervention centers. So this is a very old example of a sector of green care. But for instance, on the left, we see the forest-based care, which is with a practice of forest bathing, for instance, is quite new, particularly in Europe. This is something which is not older than 10 years. Also, social agriculture is depending on the country. In some countries, it's already quite young, quite old. For instance, in Belgium, there is a particular fish which is called the geel, which is already has been accepting people with mental health problems in their farms in the 18th and 19th century. On the other hand, in other countries in Europe, this is much more recent, although with the rural development in between 2000 and 2008, there was a measure to support at the European scale social agriculture. So at that time, social agriculture has really seen a rise throughout Europe. Looking where these services are provided, there is also a whole range of services or a whole range of ecosystems or spaces where these are provided. Social agriculture, of course, is much more focused or located in rural areas, where urban green care, as the name is saying, is much more in urban parks and woodlands. As I said, it's quite new and small sector, so the number of employees is overall quite low, and lots of initiatives are also working with paid or unpaid volunteers. The urban green care sector apparently is bigger, although this outcome is a bit biased, because there are 1 or 2 bigger initiatives, like in Italy, there is, in Milano, there is an initiative which is working with hundreds of volunteers, which is a bit, of course, influencing the average number of employees for the other cases. But overall, this is a sector with companies or with businesses that are quite small, and also a lot of these businesses are doing this as a side job. So people have their forest-based care business or forest bathing business, for instance, apart from another job that they're more doing for really earning their living. The beneficiaries is also ranging from very specific targeted interventions towards people with special needs or vulnerable groups in social agriculture. Also in forest-based care, we see initiatives that, few initiatives that really work with specific groups. Although in general, the beneficiaries are the general public or, well, organizations like schools, but also, for instance, in urban green care, we see hospitals developing initiatives to work in green spaces located on their grounds or located close to their grounds. And then we come to the real market-oriented outcomes, the financing. Lots of these initiatives are working with their own financial means, investing lots of own financial resources, but also investing a lot of unpaid resources in cases, definitely at the moment of starting up the initiative. So one of the outcomes is that there is a need for a solid financial basis for the green care market in Europe. Some future trends. First of all initiatives have noticed that the customer base and also the revenue is increasing, has been increasing, well, until the COVID crisis, and they expect that it will increase. The COVID crisis has resulted in well, very different conditions throughout Europe and very different conditions for the different businesses. So we are not really focusing on this because this does not give a good idea. But what people mentioned, for instance, during our surveys or our interviews, is that they see increased attention to, well, green care in general, or forest-based activities, for instance, as a result of the COVID crisis. People are more aware of the beneficial impacts of nature. I really want to go into nature to cope with stress and so on. What we have also seen, this is quite innovative, I think, is, for instance, online forest bathing or virtual reality or augmented reality in forest therapy. Of course, interesting, because this way you can, for instance, bring forest-based care to people who are not able to go to the forest or to nature. Still, there is an issue with the evidence. There is not an issue with the evidence, but there is an issue with bringing the evidence towards attention or having the evidence accepted by health officials and decision makers. And when it comes to financing, we see a lot of investment from the private sector, but this is mainly from clients or from the initiators of the forest bathing or urban green care initiatives themselves. And as I said, there's a lot of sustainable financing lacking at the moment. There are very limited number of pilot projects with health insurance companies, for instance, who are funding this. In Belgium, for instance, one of the most important health insurance, it's not really a company, it's an association, but this health insurance association in Belgium is supporting on a lower level some initiatives. And there's also what we also see in tourism then, that destination management organizations are really playing the card of health and well-being as a reason to go to their destination. Finally, we also noticed that there is a need for a European certification system because there's no or very few opportunities to have a training, to have a certified training for it. This training system or the certification system could help also to give credibility to the sector. Concluding, green care markets are still at an early stage. They're still growing. They're growing. They're still expected to grow in the coming years, but it's still a niche market and will probably stay a niche market. They are at the nexus of health, well-being, and sustainability, but also they're linking a lot to education and tourism. But there is definitely a need for further evidence, for bringing the evidence under the attention to people in the health sector, but also to people who make decisions within public health, but also within private insurance companies, for instance. This is linked, of course, also to this need for a certification system as discussed earlier. If you want to have a closer look into the outcomes of the market outlooks, you can go to this link or scan your QR code. And before I go to the second half of my presentation, maybe a takeaway message from this first half of the presentation is that you will not become rich from selling the pill of nature, from being a green care practitioner. You definitely are working towards enriching the society. So I see I've noticed there are lots of practitioners in the public, in the panel and the public. So please take this with you during your daily work. As I said, this is part of the Green4Care project, and as a project always comes to an end, we have been developing the Green4Care Alliance, which is a long-lasting alliance of green care enthusiasts and people who are practitioners in green care, but also people who are working research in green care, the health sector, and the social sector. With this alliance, we want to offer, the network wants to offer a platform to facilitate the knowledge exchange, to provide opportunities for learning, trainings, and for internships, to support collaboration, not only on the scientific or academic level, but also between practitioners in green care, and to stimulate the development of new entrepreneurial activities. And finally, we also want to streamline the dissemination of research outcomes in green care from research to practice. To give you an idea of what is upcoming within the Alliance, well, maybe you're aware that at the moment is running an e-learning school, but as a follow-up of the e-learning school, we will have a green care specialization school in summer 2022. And thanks to the Alliance, we will have, unfortunately, a limited number of travel grants for the specialization school. So people who are linked to the Alliance will be able to apply for these travel grants. Much more important, maybe, because we will be spreading the hackathon throughout Europe in 5 or 6 countries in the autumn of 2022. So we will be organizing local hackathons together with all the partners of the Green4Care project, but also with the Alliance and with local partners. So I hope by now you're really aware of the Alliance and you're really willing to join the Alliance. We already have about a bit under 100 people in the Alliance, so there's still room for much more. If you want to join the Alliance, it's for free. You can just go to green4care.eu/join and go to the webpage of the project and to register for the Alliance. I have given a lot of directions where we can go. There's a lot of work still for the Green4Care Alliance or for the green care sector in general. So we were very happy that we have over 100 participants at the moment who can give their input in the further direction of the Alliance. And well, will be giving the floor now to Ricardo, who is the master of the Slido and who will guide you through around 3 rounds of questions on the future direction of the Green4Care Alliance. Ricardo.
Yeah, thank you, Rick. Yeah, absolutely. As you can see in Slido, you will find the first question. You have been asked to rank the following sentences according to the topic of evidence. So you will see 4 sentences. We are asking you to rank them according to your experience or your background. We have a 3 set of questions. So let's start with the first one. So rank the 4 sentences on the basis of evidence. Okay, from in your smartphone or your mobile, wherever you are connected, you will see live the ranking of the answers. So you also, Rick, can see the results. I will share my screen so you can check it. Okay, so you see that the first place is to obtain recognition on the scientific evidence on green care. Now obtain recognition, yes, then raise awareness on the benefits of green care. Further, increase scientific evidence on green care. Last one, increase credibility of the sector. We leave still a few seconds to conclude it, and then we move to the second one. Rick, then you can comment the results. So, okay, perfect. We are okay, we are absolutely satisfied. So let's launch the second one. Okay, so the same, we ask you to rank the following sentences, but related to funding now. So ensure long-term funding for the sector, refund the participation in green care activities through health insurance, and enable green prescription. Okay, see live the results. We give you some time, some seconds to answer the questions. Okay, still Rick take notes so then you can comment the results.
Trying to make a mental picture.
Yes. So first place is ensure long-term funding for the sector. Second, enable a green prescription, and third, refund participation in green care activities through health insurance. Okay, we leave you 10 seconds to answer the second one, and then we move to the last question. Okay, so we stop it here. Okay, and super quickly to go to the third and last question, still the same structure. So we ask you to rank, we ask you to rank the following question, the following sentence on quality assurance. So to develop a quality system for green care based on certification to support regulation, to improve the quality and accessibility of nature and forests, to provide professional training for green care practitioners. You can rank them. Okay, here is the live results. Very close one each other. We'll give you some time to answer. Okay, as you can see, first place is to develop a quality system for green care based on certification to support regulation. Second place, provide the professional training for green care practitioners. And the last one, improve the quality and accessibility of nature and forest. So thank you so much to everybody for these answers. I leave the floor to Rick.
Thank you, Riccardo. Well, what I've noticed is that the scores are very close to each other. Overall, on the first question, maybe the need to increase the credibility of the sector was ranking low, which is was ranking the lowest, which is a good sign, because that means that the people attending the session are aware of the credibility of the sector and thinks that the sector already has a lot of credibility. Increasing the evidence was high, but also bringing the evidence to the other well, to the other sectors and to decision makers. I think this is really a very important next step. Then on the last poll, interesting to see, but that the quality or the need for more quality is really focused on the need for more quality from the sector itself, and that people think that the accessibility to nature and forest is the lowest, has the lowest priority. Of course, this is very dependent from country to country. Some Scandinavian countries, for instance, have this everyman's right, and it's much more easy for a green care practitioner to, if he or she can access basically any forest around the corner or any around the corner for doing his or her practice. And then, yeah, I think the second point on the funding, I'm a bit surprised to see that the lowest ranking item was this funding of the activities through health insurance systems. People are considering this as the least important. Personally, I've put this as the most important. But of course, every system in every country is different. I'm looking at this from a Belgian perspective. But yeah, this also means that well, the highest ranking was the sustainable funding. So if you have a sustainable core funding, then maybe you would not depend on funding from the participants, which in some cases is quite difficult because particularly if you want to work with vulnerable groups, or if you're working with vulnerable groups, they usually also have lower financial means. So depending on participant fees is can also create a barrier for specifics, and maybe for particularly for groups who are really most profiting from green care activities. And to conclude, maybe an interesting fact that we identified throughout the interviews is, and which relates to this participant fee, is that in Belgium, the forest bathing guides agreed on the minimum fee they are asking for their activities, and this way they want to avoid what I a bit unlight would call race to the bottom, but they are definitely not aiming to lower the quality of the activities. But yeah, as an entrepreneur, you need a good base, and you can only offer quality by having a good earning. So yeah, to conclude, I think we have now interesting guidance for the Green Care Alliance, and one more call for all people attending. Please, if you have not been doing this, join the Alliance, and we will be gradually building up our offer to the members of the Alliance in the next months. So back over to you, I think, Holm, for the first panel round, and thank you for this very interesting session so far.
Thank you very much, Rick. Thank you, Ricardo. It's very useful. Indeed, just thinking back to also the presentation, it's clear that there is a growth. There's the growth trend for green care. It's emerging, and we can see now the results of this. We're heading in the direction of more interest, more growth. And money doesn't, the practitioners who are present, it not be the most well-paid job, but money doesn't also bring happiness, they say. So hopefully nature can compensate. That said, I'd also like to say that in relation to this emerging market, or these emerging markets, it's clear that there's an opportunity for more political and economic support in the development of these sectors. But how does that fit with some of the other experts, researchers and practitioners and innovators around Europe? And in the first panel, we would like to discuss this with some of these researchers, innovators, practitioners, and I'm going to hand over also the floor now as a moderator to Mathilda Vandenbosch of IS, who will moderate the first panel. Mathilda, please. Thank you very much.
Thank you very much, Colin. Yes, I'm an associated researcher at the Barcelona Institute for Global Health and also an adjunct professor at the University of British Columbia. And I've had the privilege the last decade to work with a topic that I'm passionate about, which is nature's impact on human health, in particular childhood health. And today I have the specific privilege of welcoming a stellar panel for our discussion around market perspectives and policy in the Green4C sector. So let me welcome our four stars today: Siobhan McQuaid, Tig McIntyre, Matthew White, and Nicole Prop. I will give you 30 seconds each to introduce yourselves before we start the discussion. So Siobhan, if you would like to start maybe and say a couple of words.
Sure. Thank you, Mathilda. First of all, can I congratulate you on pronouncing these very difficult Irish names very well? So a tick straight away. So I am Siobhan McQuaid. I am the coordinator of the Connecting Nature Horizon 2020 action. I'm the Associate Director for Innovation at Trinity College Dublin, who are the coordinator. And I have the privilege of working with a number of projects in the European workforce on the nature-based economy. So we're looking at how sectors like the Green4C and other sectors in the nature-based economy can provide an alternative path, I suppose, towards the Green Deal and this vision of a more sustainable economy in the future.
Thank you. Tig? You're muted. You're muted, Tig.
Thanks so much. That was actually my best comment. You just missed, but let's not worry about that. So I'm the scientific coordinator for the Nature-Based Solutions and Urban Health Project, Go Green Roots, which is coordinated at Maynooth University in Ireland. And I'm at Maynooth University. I'm an assistant professor in environmental psychology and part of the All Institute in the Department of Psychology there, and actually another affiliation, which is what's called a Science Foundation Ireland Insight Group for Data Analytics. But I'm really here today. I'm privileged to be on this panel to learn from the voices of experience from the other panel members and yourself. Thank you.
Thank you. Matt, would you like to say a couple of words?
Yeah, hi everyone from Vienna, where I moved last year to escape Brexit, quite frankly. I was involved in the Blue Health Project in Europe. I'm an environmental psychologist like Ty, and I've worked in the sector before becoming an academic in the green sector, before it was known as green care, working with people with learning difficulties in this situation. So I've been both a practitioner and a researcher.
Thanks a lot. Paul?
Hi, my name is Nicole Prop. I'm actually a practitioner, I think. I'm Dutch, so actually your English of all of you is much better than mine. Normally I speak German, and it's not always so easy to transfer from German to English when you are passionate about the issue. So I hope I can do that. Actually, Matt and myself, we considered we are both from Vienna. So I'm actually the managing director of the association Greenfield Alliance. We are an association located in Vienna, and we are founded 2015. The association Greenfield Austria is formed by the 9 chambers of commerce. We have 9 federal states in Austria. So the 9 chambers of agriculture are part of the association. And we are more or less a competence work for the development, implementation, and creating also the educational programs for active family farms in Austria. So we are doing the green care implementation on one side, the active family farms, and on the other side, together with the stakeholder and the social agencies and institutions. We do this for nearly 10 years now. Thanks.
Wonderful. Thank you so much, everyone. So don't worry, we're not your 30 seconds of fame. You will get a little bit more time as we continue with this discussion. So what this panel will be about is that I will give you one of you a set of complicated questions. And I look forward to hearing your insightful answers. The idea is that you would get some 10 minutes each, I think, to talk, but we might speed it up since we're a little bit behind in the program. So Siobhan, could I start with you maybe and ask you a little bit about your experience from the Connecting Nature project and also your recent white paper publication. So do you expect that public and private financing of nature-based solution, do you expect it to grow, and why? Where do you think these kind of investments would come from? You're muted, sorry. Siobhan.
Yeah, got it. Okay. Well, one word answer, yes. I do expect.
Okay, next.
Maybe I think expand a little bit on that if we have time.
Sure, please.
Definitely. I mean, the UN has called in their State of Finance of Nature-Based Solutions this year. They've called for a tripling of investment in nature-based solutions by 2030 and a quadrupling by 2050. And that level of investment needed if we need to address the kind of climate change and biodiversity crisis that we're facing. So I know numbers like that sound massive and really daunting, but actually I think if you break them down, they're quite achievable. And just for two main reasons, I suppose. First of all, if I look at our project Connecting Nature, when we put this proposal together back in 2016, when Britain was still part of the EU and before Boris came and went, nobody had heard of nature-based solutions. We were really scratching our head and going, gosh, what is this concept? And if I fast forward, 5 years later, this is a concept that has become relatively well understood. Definitely has become mainstreamed in EC policy, and it's at UN policy as well. So it's mainstream globally policy and also increasingly in practice. Now, of course, nature-based solutions is an umbrella concept. So within that, you've got some areas like urban parks and green spaces, which are very well known, and other kind of blue-green nature-based solutions, or even blue-green-brown infrastructures or nature-based solutions, which might be less well known. But we've done a lot of, we've started, I suppose, initiated a lot of research around the private sector. And when I say private sector, it's not just for-profit companies, but also not-for-profit enterprises that are working in this space. And we're hearing from them recently, even in the last couple of years that we've been tracking them, that they're experiencing increased demand for nature-based solutions. So the market demand is increasing. So that's the first reason, I suppose, the concept has become mainstream, not just in policy, but also in practice, and that's resulting in an increasing demand on the ground. And another key reason, I think, why we can expect investment is because we're seeing increased interest in investment from the private sector. And I mean that both in terms of corporate investment and institutional investors. And it's important to look at where we are now. So right now, 86% of nature-based solutions have been financed by the public sector, 86%. So when you talk about tripling and quadrupling, clearly you can't expect the public sector, with their budget stretched across so many areas, to be responsible for that. So it's time, and it's great to see that the private sector are becoming more interested in investing. And the EC presented some of the recommendations from our white paper on the nature-based economy at the European Business and Nature Summit yesterday. And the corporates that were on that panel were strongly supportive of this concept, and they were calling regulation, make it mandatory that we have to carry out this kind of value chain or reporting on our use of natural resources throughout the value chain. Now, I do appreciate that the people on that panel might have been picked because of their position, but I think what we are seeing is that overall, there's a spotlight on the importance of natural capital. There's increasing spotlight on the environmental track records of corporates and investment funds. So that is translating into an increased investment. And just one example that came up yesterday. So there was the CSO of L'Occitane there, and he had mentioned that currently 10% of their materials are sourced from regenerative agriculture. In 3 years, their target is to source 90% of their materials from regenerative agriculture. So if that gives you any indication of the kind of growth in demand, I mean, in a very short period of time, and we've already seen it in the last 5 years. So I think it's definitely really a really growing opportunity for increased private investment as well as public.
Wonderful. It's lovely to hear your optimism and these fantastic numbers, tripling, quadrupling of investments in nature-based solutions. That's amazing. So you mean that most of it is investments from the private sector? Would you just have something to say about the kind of policy change you would say is needed to facilitate more investments from the private sector? Can you have any ideas around that?
Yeah, well, I mean, I know we're a little bit running behind. So there were 22 pages, I think, of recommendations, way too many in the draft white paper. So I'm not sure, I think some of my colleagues might be able to post that in the chat or on Slido or whatever. So anybody who wants loads of recommendations can look there. But if I summarize just some of them, which I think might be relevant to some of the points which are coming out from the last session, and in particular the survey, I suppose there's a lot that can be done by policymakers to support the emergence and the sustainability of sectors like Green4Care. So what we are seeing is that while concepts like nature-based solutions are well taken up, say, in the environmental sector, they're not well known across other policy areas. So you've got a lot of the kind of silos that are well known, and like health do their thing and no, nature is for the environment department and so on. And in particular, what we need to support the growth of practitioners in this area is for economic policymakers to turn around and start recognizing the value of this sector, both in terms of social enterprises, but also I think our research conducted by my colleague Esme identified that 2/3 of nature-based enterprises are actually either hybrid or for-profit. But to recognize the value created by these types of enterprises and to put policies in place to support them. And I think that also require a fundamental shift in how we help policymakers, I suppose, how would I say it? How policymakers put in place a measure value. And I would say we need to look at considering alternative measure of value, like their contribution to the environment, contribution to health, and instead of their contribution to, say, turnover and job creation, which is standard measures used today. So we need that kind of fundamental shift. And I think that is more consistent with the long-term kind of aspirations of the Green Deal and a kind of a nature-based economy. So that's I suppose, policy at a policy level. There's lots of other things, question of standards came up. And that was something that has been called for right across the board. And of course, there is the IUCN global standard at the moment, but it's very voluntary. And, there has been a lot of accusations of greenwashing coming out that, people are jumping on this bandwagon, which is normal as an industry matures, but I think there's a need for looking at standards and ensuring that it's not just the large companies setting those standards, but the voice of the small enterprises, that the community groups, the volunteers that are working in this area, that their voices are also heard in setting those standards. I could go on, but I know we're short of time and we're a packed panel. So, I would love to get your feedback on the report on the draft white paper. And if there's time for discussion, that would be great.
Yes, that would be great indeed. I would love to discuss more with you. You're right, we're a little bit behind time. So I would like to thank you very much for that input so far and continue asking you a little bit, Tig. Nice to see you again. So we're working together you are leading the Go Green Routes project, which I'm happy to be involved in to some extent. And within the project, you look at nature connectedness and health benefits in urban areas. And as Rick reported in the Green4C market outlook, we looked at urban green care in particular as one of the parts, and where we noticed that this, for the most part, facilitated for most part, it's public bodies that facilitate the use of urban green spaces for care. And how do you think we can facilitate the flow and use of spaces for urban green care for health and well-being? And how could they possibly be paid for, you think, based on your experience?
Yeah, I guess the finance question is probably slightly beyond my remit. And as those, I'm only recently an environmental psychologist, so I'm primarily like a health well-being practitioner psychologist working across typically within sport areas. But I think we probably need to look at where the evidence base is, because that has major ramifications for where we can grow. So the evidence today, and I was really enlightened to see Evelise Barbosa's paper from IS Global that I did earlier today. That's fantastic on on the effect of green space for all-cause mortality, and that's really interesting. So if you take it on 3 levels, we actually know that access to green space is important, and that was particularly highlighted during lockdown scenarios during the last 18 months or so. In fact, we have a scoping review on that topic with Karina Nigg and Evie Pedersen at the moment, which is under review. But I think we know that nature had positive impacts upon the health and well-being. And when people were denied that, what some people might call green poverty, that had major detrimental consequences for them. So if we go one step further, we look at the quality of the green space. We know there's an emerging literature on that. That's a really interesting question. So, in some ways, what's the configuration of the nature that's required? What's the role of natural soundscape? And can we move away from the, it was actually Howard Frumkin pointed out about 20 years ago, he had a paper entitled Toxicity. So can we move away from viewing urban green space in terms of, risks? So can we move beyond looking at the co-hazards of noise and air pollution? Can we focus on the role of biodiversity and almost market that in the cities, in the townscapes, and the role of the natural soundscape, the tree canopy cover for thermal comfort, all those configurations which are going to be important due to climate change and other factors. And then we'd say in our project, we're based upon our stool has a third leg. And that's around nature connectedness. So it's not just access to GES or green space, it's not just the quality of it, although we know from major reviews by Ertz et al. In 2018, I think it's critical. And we're able to perceive that, which is, I think, a relatively new finding. But actually, how connected are we to that nature? Because, it's a really interesting question. Today, I've noted then that we've had connection with nature, love for nature, love of nature. So, even that construct, with hypothetical construct to show, the intimacy of our relationship with nature, and to what extent that is, grounded in our developmental milestones or childhood experiences, and how, that can be best construed as being trait or state-like. That's a really important question. And today, we've kind of left that in the realm of a more prosaic literature. It's about wilderness. It's not really about urban green space. And look, I'm really happy to say one of our, outstanding early career research on our project, Cassie Murphy, is working on this to look at the construct of urban nature connectedness as being distinct from connecting to nature in other settings, because there are distinct features that, operationalize urban nature. So the model I perceive, which might be most efficient, is perhaps not the traditional model, and it's one based on ensuring that there's inclusive access to, high quality green space in cities, which absolutely align with UN SDG 11. There's actually a specific target on this, 11.7. And not only that, is that we can have ensure that nature access, not just green space access, but high quality nature is ubiquitous in cities. So this WHO guideline from 2016, half a hectare within 5 minutes walk your house. Well, if that half hectare, has some areas which are bespoke and configured for, restoration, almost a therapy garden, and other areas are designed to promote resilience. So in other words, we have a capacity, certainly in medium-sized cities and evolving cities, as that's the median size city in Europe is between 100 and 150,000. So there's great scope there for renaturing these cities in a way which ensures this common access to high quality green space can have a significant benefit, not just for all-cause mortality, which is one way of looking at it, perhaps another lens. You know, this can increase resilience, it can increase productivity, it can increase cognitive performance, because nature's been shown to have these impacts in discrete studies. And, you know, there's really interesting research emerging on the concept which is it's really important during a pandemic, which is empathy, which sometimes get lost in some of those polarized debates, right? So I think it's really promising that there's new directions here. And those new directions only occur because the bedrock of evidence has been sound. And now we can push the envelope a little bit more, ask questions which are more bespoke to, you know, marginalized groups, to the elderly, to ensure we have intergenerational space, to ensure that, access to what we call the Hyde Park problem, access to Hyde Park in London, may, if you've got COPD, certainly it's probably detrimental to your health, as one study has shown. So I think we need to know that, you know, some of the adverse effects of nature, be cognizant of that, ensure that, you know, when we say, you know, there's space, you know, proximal to you, that we take into account the quality of it, the soundscape, the air quality, and that we promote access to this, not just through awareness. And this is an interesting point. I've been reviewing the literature recently, and, you know, a lot of people talk about let's increase awareness of, of green for care, for example. It's even a question posed earlier. Well, let's, you know, build on what happened during lockdown. People went to green space. Sometimes as a result of what we call physical activity displacement. Other opportunities for physical activity and movement and mobility were restricted, but people did move to green space, and that they moved for so long, depending where you were, how strict your lockdown was, that it's potentially habit forming. So we actually have, you know, habits across Europe, across many countries which are similar, which have now matured and been developed and reinforced over time, which are still continuing. And I just know from, you know, our forestry research here in Ireland, Cuilcha, is that forest visits tripled during lockdowns. So people really, flocked to the forest. They're still flocking to the forest. So that trend has stabilized rather than diminished. And that's a really interesting thing for us to build on. Nature is now, as Ursula von der Leyen would have asked us with the Biodiversity 2030 strategy, it's now at the center of our lives. We need to keep it there and build on that.
Yeah, couldn't agree more. Fantastic. You know, I'm so fascinated by the Go Green Roots project, and there's so much to talk about, but being wary of time, I think I will move on, and we can keep on giving questions if there are time later. I will move on to Matt. Nice to talk to you again. So as you know, in the Green4C project, we are obviously looking at green care, while you have brought amazing expertise and done a lot of pioneering work in the area of blue spaces. First of all, would you maybe help us to understand a little bit more what blue care actually is and how it would compare maybe to green care?
Thanks, Matilda. It's hard to follow those two, isn't it? They covered an awful lot of great ground. I mean, I think Rick already identified blue care 2,000 years ago, right? When he was talking about the Romans and spas. Yeah. I think that hits the nail on the head. I mean, thalassotherapy, there's a theme going through Europe, but it's been very much targeted, let's say, in the last 50 to 100 years to the wealthy. So blue care is often associated with wealth, and it always was to a large extent. So in the 1700s in the UK, it was really the royal family, when they were bathing, that convinced the rest of the population that this was a good idea, and there were several bathing water hospitals set up. In the day, these cost millions of pounds, so there was major investments back then. I think a number of people have also mentioned tourism. I mean, blue spaces are the top 8 of the top 10 destinations for tourism. So that already happens. People are medicating, if you like, by going on holiday to blue spaces. That's quite evident. And what's interesting about the natural spaces as part of spas, it's far more ethical. So you see all sectors of society going to lakes, to rivers, to the coast. Where if you look at woodlands, now I know the British data the best, but I've also looked at several other countries, you tend to find it that's the richer, wealthier, healthier populations anyway. So actually blue spaces tend to be great at reducing the inequalities potentially. And I mean, people, Matthias earlier mentioned the social dimension. What we found over the last 10 years of research is that probably the largest additional benefit of blue spaces is their social spaces, more than some of the other ones. People are really congregating together to spend quality time with friends and family for various reasons. And I mean, I'm a big fan as a practitioner in the past and as an academic now, but I'd like to echo what both Matthias and Ty were saying about being cautious about thinking about the negative potential impacts. And as Siobhan was saying about we're becoming a mature discipline, so to speak, we need to get our act together. It's quite interesting to see people, I think, are buying the general evidence. Okay, blue spaces, green spaces are good. We've done that. We don't need any more evidence. We need to implement it. But now we're at a stage where we have to say, well, exactly what it is that you're asking for. And that's when we come down to issues of dose response. We come down to individual people who may or may not benefit under what conditions, because otherwise there's going to be a backlash. When one or two of these projects goes horribly wrong, then there's going to be a media outcry and say, well, why was this regulated? Why was this allowed to happen? And then the whole area can be undermined. And I'll give you one concrete example. So for example, in our research across 18 countries of Blue Health, we found that people with anxiety disorders, clinically diagnosed, were more likely to spend time and visit blue spaces, perhaps for contemplative reasons of regulation. However, if they felt pressurized at all to visit those places, it undermined the experience, right? And that's a very common thing known for 20 years in psychology. The behavioral economists call it crowding out. If something's intrinsically of worth to you and you're told to go and do it, it becomes an extrinsic motivator and it undermines the benefits you would actually get. So prescribing somebody something that they wanted to do anyway may actually undermine the benefits. And we've seen that for technically clinical populations. So we've got to be super careful about starting where people are coming from, rather than saying, we've got a recipe for you, let's do that. It can undermine the whole thing. So I'm certainly not, against expanding the field, with the note that the bigger you expand it, the less qualified people may be to deal with the mental health, for example, challenges or needs of people with learning difficulties, because they're specialists in other areas. Mm-hmm. So as a psychologist, my first allegiance, of course, is to maintaining the well-being of the individuals taking part. And it needs quality training of people working with specific groups in these things for that not to go horribly wrong, in my opinion.
Yeah, this is so fascinating. I love behavioral sciences. There's so much to learn and understand. So unfortunately, I will cut you a little bit short as well, Mats. And I said we might be able to go back a little bit and turn over to Nicole. Very nice to meet you here. And you play a key role in the Austrian project Green Care, where people flourish. I could not pronounce or say it in German, I'm afraid. So we translated and this project develops and implements social services on active farms in Austria. How did you manage to lobby for having green care embedded in national policy and rural development plans through the Ministry of Agriculture? And what effects would you say that this have had on the market or have on the market of green care in Austria? Any thoughts on that?
Well, thank you, Matilda. Thanks also for the previous speakers. I think it's very important to have this network built. I can show you or give you some information from the field, doing an implementation project down to earth here in Austria. And I think it's very important. We started the project 2011 with the Chamber of Culture in Vienna, because that was, so to say, our starting point. And we actually, as you asked me the question up front, I will do some research myself, because when you are doing a daily job, then you think about that. But actually, we did quite some lobby work in the beginning, and we do it every day, actually, in Austria. We started 2011, we went to the European Parliament 2012. So we had our Ministry of Agriculture, she was sitting also in the European Parliament. So we did the presentation in 2012. And for us, very important is in the year 2014, we founded I think you call that working group, Greenfield Austria, and had nearly today 25 national stakeholders from agriculture, from education, from the social, from the health, and from the education base. So in Austria, it's very important that we have this holistic view. And we are coming from the agricultural ministry, but we're also doing lobby work, actually a lot of lobby work with the other sectors. So educational, health and social areas. It's very important. And we started this working group in 2014 and it's still meeting twice a year with all the 25 stakeholders. Actually, it's mentioned already upfront. For us, it was always very important also for the funding that we do, so to say, we wrote a green care strategy. We had the role model of Norway. So in Norway, also the 25 stakeholders in Norway a long time ago also wrote a green care strategy. So we did the same in Austria with the stakeholder together. Part of the goals is, of course, the awareness, what we heard today, but also the quality assurance. So we make the impression in Austria where we do not have a quality insurance, then it's very difficult for the funding. And it's also that we have an external certification body who do the certification process. So we actually have an external evidence that the work done on the farms is also guaranteed. 2017 in Austria, we had a really big movement. Politically, there was a so-called master plan for the rural areas in Austria. We have the problem in Austria that we have very small-scale agricultural farms and they need diversification. And based on that, the rural areas in Austria are very important. So the Ministry of Agriculture, they set up a strategic process with all the communities. We have more than 2,000 communities in Austria and they all put in very important information. How can the rural areas be attractive for the people? So we have this rural migration. We have to stop the rural migration. Yeah. And therefore they had this master plan for the rural areas in Austria with 20 priorities, and green care was also part of the priorities, because I think it's important that the rural areas, that they also have social services. So social services on active farms is, I think, an innovative, future-oriented model, not only for Austria. That's also why we have, during the Austrian presidency of the Council of the European Union in 2018, all the rural development directors of all the European member states were in Bregenz, and they had a meeting, and we actually presented the practice of green care in Austria. And I think it's practical in all other countries, because I think the challenges we have as a civil society, we have them today. We cannot solve with current systems. So we need to think out of the box. We need to go holistic. We need to connect agriculture, social, health, and we have to do, of course, a lot of evidence-based work, but also have to do some practical work. And I think in Austria, we have a best practice here. That was also based on our prize. We had the Inspiration Award that was done by the European Network for Rural Development in Brussels. And there were 125 projects, and they need experiences from the field. Actually, the green care idea to go for social services on active farms together with institutions and social agencies, they see this as a big innovative process also for other countries. So I think we have to stick together. And it's very important, I think, that we do building networks, very important community level. So we have in Austria, as I said, 2,000 majors, because we have 2,000 communities, and they have to know what green care is. You know, when you are a major in a rural area and you don't know what green care is, because you think it's maybe a green car, and you don't know that it is social services, and you need that major. You need social services for elderly people, for people with disabilities. We heard it today, long COVID, children. So as a major, you should know what is social service. We have a lot of farms in Austria. They have perfect conditions for all those settings. We heard that up front. So to shorten because I know that we in the lack of time, I want to mention one thing. I should say, what are the effects? I think we have a very structured, very centralized system in Austria with a very high quality level. And we actually assigned the Austrian Institute of Economic Research, the WIFO, and they did the research for us about the value creation. Because a lot of people say, yeah, green care, social services, it's nice, yeah, but what's the outcome? So actually this Austrian Institute of Economic Research did the research last year. And we actually asked about 40 farms, so active green care farms in Austria, and only 40 farms actually contribute I have to say, I have to look here. They contribute an operational regional value of more than 11 million euros a year. And we have about 600 jobs by only 39 farms. Yeah? So I think also the regional value is very important, and we need a strong brand, European-wide. We need a strong brand. We need good funding. We need very high quality certification processes. And then I think the funding is there. And this holistic idea is very important, I think, that we actually work together. And last but not least, I think we have all the similar challenges. Yeah? So I think the challenges we see at the farmer side and we see at the civil society in Europe are more or less the same. And I think with Green Care, we can build the bridge between the agricultural and the social challenges. And with Green Care ideas, we can build bridges. Although we have, of course, local and legal requirements in every country. And I think one thing which Mrs. McQuaid said, the funding, I think also the private equity, the social equity funds, I think we have to make sure that social equity is also funding those kind of systems, because we want to get elder, we want to be healthy. I think it should be part of our normal systems that these things are implemented. Thank you very much.
Yes, indeed. It's fantastic talking about impact. And I couldn't agree more about the need for a change in our thinking. And talking about change, I just got a note from the organizers that we will have a slight change in the program and have a slightly shortened break between 16:55 and 17, if I got it right, I think. Okay, so I will now. Am I just going to, I was going to say that I will have a premiere Slido. Is this correct? That I will go over to that directly?
Yes, if we have Ricardo there. Ricardo, are you with us?
Matilda, you can read here the most voted questions. I will highlight them so you can have a check. There is also a question to Rick and to Davide Pettanella.
Okay, fantastic. So then I'll just start. Oh, now. So from Nina Alida Nörbo. No, all right. So maybe this is for time at least. I take it now quickly. If we keep flocking to forests, how can we ensure their sustained structural quality and the quality of benefits they provide? Tag.
Yeah, thanks for the easy question. Yeah, look, it's a paradox, you know, that we all have to deal with. You know, we need people to get to nature and we need to protect the nature. I guess, look, we need to apply a framework for that. And one of the ways we've devised in our project, Go Green Roots, to do this is to engage citizens as custodians of the natural environment. So rather than leave it up to municipalities, you know, to maintain natural areas or different forestry service, for example, to engage citizens through different community initiatives. So we have a concept of engaged citizen science. You can engage schools, you get different learning institutions involved, and community action groups. And that means that it becomes, you know, part of a place-making process for the community, which means that they are vested and grounded in both, you know, developing a bespoke natural environment to meet their needs and also looking after the ecology and the long sustainability of it. Yeah.
True, very good point. So I go on with a question to Rick. Why one certification system? This is new innovative domain connected to place and local community. Fundamental questions on tendency to standardization.
Yes, thank you, Matilda. Thank you, Hans, for your question. Well, I don't think we definitely should go to one certification system, but we learned from the interviews that there is at the moment, well, not really a certification system. Well, Nicole Prop was mentioning a certification system in Austria, so maybe we can learn from that. Yeah, it's always, of course, a challenge to develop a certification system which is flexible and adaptable, and I definitely agree that it should be adapted to the local situation. But the main idea, or the main challenge, or the main missing point was that there's at the moment no certification at all, and that without insulting people, but that people have to refer to their trainings they're doing, their publications, and there's no really objective standard or measure to refer to as a practitioner, or also right. as some organization that is going to fund the green care. Thank you.
Right. Thank you. All right, so I will take a question from my dear friend and colleague Tahia de Vissers, who I think deserves a reward for attending from a very early morning hour in Vancouver, Canada, if she's there. To Davide, what specific green care initiatives did you find most mentioned in your review of NRRPs?
Yeah, unfortunately, I'm not able to answer in a proper way to this important question. Let's say that there are 3 areas of financing activity in the national plan that may be related to green care, but only one can be properly linked to our field of interest. That is that one connected with new investments in urban forestry. This is a quite common area of investments in the national plans. And there are 2 others that are too general, described in a too general way. So you cannot really deduct any clear information about the use of funds for green care. And these 2 are that one that is called green jobs, but you know, green jobs may mean quite a lot of different type of activities. And the other one that is connected with health and social services. Again, here we can hope that some money will be spent in our sector. But let me add only one last point, that the Austrian experience in using funds coming from the rural development policy is now imitated. It's a model that is followed and taken into consideration by other countries. And I really think that with these new ideas about financing social services, non-food connected activities through this instrument, some funds will be available also in the future, more funds available in the future for social agriculture and the use of forest for green care.
Wonderful, thank you. Great, so to Nicole, an interesting question. It's interesting to see the economic value created by active farms. Do you also measure the social value created in monetary and non-monetary terms?
Thanks for the question. I think what Davide is saying, it's important that actually those funds are more open for social, for green care, social activities. I think an answer to the question why we did this V4 research, actually I sent the link in the chat, is because of we do a lot of lobby activity, because we are a project more or less funded out of the European Agricultural Fund for Rural Development. So the work we do in Austria is more or less paid for out of this fund. We are based on this measurement 16, promote horizontal and vertical cooperations and creation new development models. And because of the next period is coming with in Austria 2023, we had evidence that green care is not only a soft component, so we have also hard key facts, and the hard key facts, actually that's why we did this study with WIFO, to make sure that the people don't think, yeah, it's nice that a few elderly people are coming to the farm, but how can a farmer survive? Because I studied economics and I actually worked in the international companies. So the thing I see in Austria is that a lot of say, oh, it's nice. And when you then say, okay, and what does it cost? They say, yeah, I will do that anyway. Yeah. So awareness on quality and on costs is very important for, I think now at the beginning. Of course, the soft components are also important, and we don't have a study yet on the soft components based on the customers who are visiting the green care farms. We did a few questions during the WIFO study, so we have some feedback from the farmers, and the farmers are giving feedback to us what the customers are telling to the farmers. That feedback we have, but we didn't do the research on the customers, what they think about green care. I myself am Dutch, and I have some green care experience from the Netherlands based on my parents. My mother, she had dementia, and she was 3 years at the green care farm, and 3 years not in a, how you say that, seniorenheim. Please help me in English. What's it called? Somebody who's seniorenheim.
Senior elderly home?
Yeah. So I think what I think is very important as a community is that we do much more professional marketing. We do much more, that doesn't mean that we do marketing without evidence. So we need the evidence, we need the research, but we need the professional marketing. We need a strong brand. And also we need clear offers with also a cost-based business plan behind it. I think without a business plan, no business is working without a business plan. So I think we need the people who are enthusiastic, we need the researchers, we need the certification companies, but we need people who do a lot of lobby also at the European level on brand, on marketing, what are the added value, what's the unique selling proposition, etc., etc. And I think that's very important, and it would be great if we can do some more work on that. I don't know if Georg Wiesinger is part of the participants. With Georg, he did with a lot of other people a couple of years ago a co-action where a lot of companies were coordinated on the green care area. But I have to say one thing is that we in Austria, this experience in the field, we have always the setting active agricultural forestry and agricultural businesses in cooperation with social agencies. So the work I'm doing is always on the active farms. Green care is also, of course, a lot bigger than farms, but we think in Austria that the farms have a good field for green care activities. And that's why we actually focus on farms and forestry businesses.
Yeah, fantastic. That's great to hear. I don't know what's other thoughts really, because there are a number of super interesting questions. But you might post as a homework afterwards. I don't know what the organizers thought, because I think it's my painful duty to close this super interesting session. And thank you so much, all panelists and keynote presenters, for sharing of your extensive knowledge and pertinent expertise. I would like to suggest we give a grand round of virtual applause to all our speakers, and then I want to hand over after the 5 minutes break, I think, for panel 2, moderated by Shirley Gleason. Thank you so much.
Thank you.
Yes, thank you, Matilda. So if Shirley is there, Shirley Gleason. Hi, Shirley.
Hi, Colin.
They're super behind time, but I don't know if you want to. We can take a 5-minute break and come back. Yes, I think we need it.
I think we need a 5-minute break. So
okay.
Yes.
Okay, thank you. Okay. And you can moderate directly. I just say one last thing, that the Slido will remain open for Shirley's panel discussion, the same Slido, so you can continue to ask your questions in the same Slido discussion, and at the end of Shirley's discussion, she will be able to answer again like this one, the top question. Okay, and then Davide, Professor Pettinella will close the meeting. So we'll see you back here in 5 minutes, max. Okay. Thank you very much.
So maybe my panelists can join me. You want to turn on your cameras so we can get started? Great. Hi, Marie. Hi, Ray. Hi, Nevin.
Hey, how's it going?
Great. Hi, Michal. How are you? That's great. So we'll get started. So welcome, everybody. My name is Shirley Gleason, and I'm the Community Ambassador for the Nature-Based Enterprise Connecting Nature platform, Health and Wellbeing. And this session, we're going to look at nature-based therapies for prevention. So I think Rick had mentioned it, and also Davide, the importance of innovation and good practice in this area, post-COVID. We're facing a lot of societal problems. We're facing a lot of difficulties within the health sector. So we're going to need innovative and ethical professional practices that are evidence-informed and culturally appropriate. And I think in terms of nature-based practices, we'll hear from the different practitioners, and we also have some academics who are also practitioners, which is great. The importance, to put the rights of nature and the natural environment. We work in partnership with nature, rather than use nature for human well-being. So I think that's important, just in terms of the work that we do. So I'll briefly introduce the panelists, and then the format for the session will be each panelist will speak for maybe about 5 minutes, just about the work that they're doing, really to get an understanding of the practice on the ground. Then we'll go into a number of questions about the challenges facing practitioners, about the opportunities, about the support required. So really to make it applied and applicable to maybe people that are watching and are interested in the area. And then please put any of the questions on Slido for any of the panelists, put their name so I know who to ask them to. So I'm just going to briefly introduce the panelists, and then they can introduce themselves. So first of all, we'll have Professor Nevin Harper, and he's from the University of Victoria in Canada. And Nevin can give a little bit more detailed introduction. So you're very welcome, Nevin. Thanks for joining us. And then we'll have Dr. Lee-Marie Rodriguez Morales, and she is from the University of Wales, Trinity St. David, and she's also a wellbeing practitioner. Then we'll have Ray Burke, CEO and co-founder of Active Connections, which is an adventure therapy social enterprise based in Ireland. So you're very welcome, Ray. And then we will have Micheál Connors, who's the co-founder of Natural Academy in the UK. He's also an eco-psychologist. So you're all very welcome. So I might hand it over to the floor to Nevin, just to introduce yourself and say a little bit about your practice, Nevin.
Okay, thanks, Shirley. Thanks for the invite. Happy to be with you all in this forum. Would rather be with you around a fire, but such as it is. Yeah, so I am a professor at the University of Victoria in the School of Child and Youth Care, where I teach group facilitation, individual, group, and family counseling skills. Outside of the institution, I'm still an instructor trainer for outdoor leadership for the Outdoor Council of Canada, as well as with our national paddle sports organization, Paddle Canada. So I've kind of kept my foot well planted in the field. I consider myself a scholar practitioner. Rather it be practitioner scholar. I put myself first and foremost in practice, and then happened to be employed at the university. My background covers a number of practices that would be called by different names, but I've been called an adventure therapist, a wilderness therapist. More recently, my work has been more local. So as a nature-based therapist, an outdoor practitioner, I'm a registered clinical counselor in my province of British Columbia, and also run trainings in nature-based therapy as well for counselors, both online as well as locally. Yeah, I'll leave it at there for that. And I'm calling in from the Cowichan Nation, which is our local First Nations unceded territory on what is colonially known as Vancouver Island, Canada.
Great, thank you, Nevin. Lee-Marie? Okay.
Hi, everybody. Thank you, Shirley. Thanks for the invitation, and good afternoon for a very soggy, wet, and cold Wales. I'm a lecturer, work as a lecturer in psychology, mental health, but I'm also primarily a wellbeing practitioner. I've been a practitioner for a number of years. And before arriving, I gave me a kind of similar story to Nevin. I used to work in a number of years in outdoor education, youth mentoring in the outdoors. And that kind of led to eventually to train as a psychologist. And currently my work is 90% based on facilitating nature connection experiences, mostly with groups, vulnerable groups in West Wales. And I've been lucky that there's a very strong tradition in Wales. We have around more than 50 projects for more than 10 years that have been organized locally, local communities. So there's a vibrant community of practice already established. However, more recently, due to the Wellbeing for Future Generation Acts from the Welsh Government, there have been more interest in pushing health policies and social care frame within social prescribing initiative, which is quite a good news, really. And obviously, with the COVID-19 pandemic, there has been even more interest in facilitating better opportunities. I would say sustainability of the projects in long term. I would say that will be one of the key issues. In terms of my practice, I work with a number of local organizations facilitating well-being nature, mostly young people. And I would say that it's really hard to really pin down exactly what I do in one way, but I think that's informed by a variety of approaches and integration of examples of good practice and communicating and creating partnerships with local practitioners as well. So I'll leave it like that, and hopefully with questions I'll be able to develop according to interest. Thank you.
Great, thanks Lee Marie. And we'll hear from Ray now. Yeah.
Hi everybody, good afternoon or evening or whatever it may be. I'm Ray Burke. I am a founder and CEO of Active Connections. Active Connections is an activity-based intervention service. We started out primarily as an adventure therapy service, but we've diversified quite a bit, specifically through the COVID times. I think that's the last 150 years. I think everybody would agree that that's what it feels like. And to work an awful lot more with young people and adults with complex needs and additional needs. I still get to practice a little bit, so I'm a well-being social care practitioner, but the majority of my job is sitting in an office and supporting the development of the organization and growing that, and thankfully growing our impact. So that's very much where my focus is in the majority of my time. But thankfully I do still get to see beings, young people generally. So that's who I am, and that's where I am.
Great, thank you, Ray. And Michal, hand it over to you. Okay. I think you're on mute. You're on mute, Michal. Yeah.
Oh yeah. Yeah. Hi everyone. Shirley. I'm calling from a soggy UK, cold in Bristol in England. My name is Michal Collins, and I'm a director of Natural Academy, which is an educational organisation. And my background was in economics, and then moved into education, health, psychotherapy, and then nature-based work as a mountain leader. And we're an eco-social enterprise, not for profit. And we're really interested in different business models and trying to find new ways to build collaborations and connections that aren't in the traditional way. We train people to facilitate nature, health, and well-being. And we also have a 3-year vocational pathway in eco-psychology and nature-based practice, which offers nationally accredited training programs. I was thinking about careers and richness, and people were talking about, sort of the lack of career in this field, and I think it's something I'm really interested in. And of course, richness is, I think, as Tag said, a lot more than money. And so one of the things we're really interested in is vocation and the calling to this work, purpose, meaning, connection, supportive community, something that really, is part of these values that we're exploring in nature connectedness and recovery for people and nature. And so with that in mind, we also set up Nature and Health Practice Network, me and other practitioners in the UK, and it's an attempt to establish something that supports, professionalizes, advocates this work. And yes, one of the things we've been really working with recently is a thing called Nature Well program. This is working specifically with, within green care, and really an integrated approach that really brings people and nature together, and the recovery of people and nature together, and the well-being of people and nature together. And one of the things that we've been really working with is the NHS here, working with other partners both in health and the environmental sector, looking at how we can bring training in to upskill and professionalize the work that they're interested in doing or already doing, and how we can make green care a vital part of a nature-rich placemaking around places, organizations, buildings, cities and rural environments. UK obviously doesn't have very much wilderness left. And yeah, we also are interested in developing an ecotherapeutic model, a bit working really with deeper sort of eco-psychological processes, ecotherapeutic processes, looking at recovery from trauma and restoration, emotional regulation, holistic relational connection, personal social ecological frames for understanding what it means to be human. Yeah, and really delving deeply into this field of study, and really excited by this conference and really enjoying all of the speakers that have spoken so far, and really appreciate the amount of thought, feeling, time and resources have gone into this emerging field. So great to be here. Thank you.
Great, thank you for that, Micheál. So we can see that we have such a wide range of expertise and skill set right across, you know, the life stage. So I think this work is really important, and it's going to be even more important for the future, especially in relation to youth mental health and in relation to other comorbidities and other health issues that's emerging since the pandemic started. So we heard Rick say about, you know, we mightn't get rich, but we can enrich society. And that's the case, you know, with practitioners. There's various struggles, you know, in terms of funding, in terms of how, you know, you maintain a sustainable nature-based enterprise, how we can work ethically and not exploitative. I think that's really important. So maybe just to ask the panel members, you know, what challenges are you currently facing, you know, in your practice? So we'll have a look at the challenges. What's the kind of real challenges for our practitioners on the ground? So again, we'll start with Nevin, and we'll go around.
Am I going to be first to answer all questions, Shirley?
No, we'll put you last the next time, Nevin.
Good. I think, well, one of the things that comes up quite often in our trainings of nature-based therapists is the fact that we work mobile for the most part. Like, we have a consortium on Vancouver Island where there's, I don't know, I think there's about 25 of us now. And we primarily meet people in what we call nearby nature, which means a local setting for the client. That could be a walkable distance from home or after school. So it's a park, a beach, a forested trail, a hill, somewhere. It's not an office setting. It's not on, you know, your clean 50 breaks for a counselor schedule. It's not that you can fit 6, 7 clients in a day. It's more like, you know, 4 is a good day. That's busy because there's transportation between each session. And so a lot of our practitioners are looking at if it's appropriate for clients to actually meet for longer periods of time and maybe less often. And again, that the limitation there is, you know, whether there's insurance or third-party benefits or some form of government care that covers the costs of those longer sessions, because sometimes there's limitations on that as well. And so that's one of the limitations, is just how do you make a living as an outdoor therapist? Another is also just from a regulatory standpoint, we have some limitations around what we can actually do. And so with our counseling association, we've gotten to a point where the walk and talk has always been okay and is still always okay. It's just when that walk and talk happens to be a little bit off trail. And you start entering into terrain that may lead to, you know, an incident of a twisted ankle or a scratched arm or something. There's where the liabilities come in. And so we've come to a conclusion that if there's specialized equipment or any specialized knowledge required, we're calling it something other than just what our regular counseling association covers. And we have to move into that next realm of insurance, which I'm sure Ray is familiar with in the adventure therapy realm. That, or we just use a lot of partnership agreements with other organizations. And so the model becomes complicated, whereas a private practitioner might have a space, a schedule, and clients. The nature-based or outdoor practitioner often has a lot more moving parts. So some of that is I guess to Michael's comments, like it's a passion project. and we just take it on as the extra work because this is the work that we like to do. And it's usually countered in most practitioners' minds when they realize that they're also going to be doing self-care at the same time they're seeing clients, as opposed to being in the offices. So I count that argument of a limitation with the benefits of being outdoors themselves. I'll just stop talking there.
Great, thank you, Nevin. And I think that's a big thing that's come up for practitioners that I work with, is the whole area of self-care, especially with the climate crisis, eco-grief, eco-anxiety. How do you manage yourself within that? But also, as a practitioner myself, you know, group work indoors is a lot easier than group work outdoors, you know, because there's so many different moving parts and there's so many different things you have to hold. So the skills are quite different, and you need to think on your feet a lot, which can be very difficult. So thanks for that, Nevin. We might go to Ray next, just because you're in our space, Ray. Yeah.
There we go. A couple of the difficulties that we're seeing is onboarding staff, people that are qualified in a psychological counselling, social work background, but also in Ireland have to have those really hard bits, because really interestingly, the field of psychology and so on like that is reasonably loose. There's a couple of different organizations that are governance and so on like that, but actually it's our insurance when it comes to our activity-based side of things is far more tight, and if we make a mistake, we're done, simple as. So having people that bring those two and are very effective in those two fields, that are able to marry them together, is probably the biggest difficulty that we face. Interestingly, we have a really great relationship with our national social work department. They would be our biggest funders, but as they feel different pinch points over this COVID, they're asking us to diversify into fields and that really aren't in line with our mission and vision. So we're almost being forced into pushing back quite vehemently and quite strongly to stay within our mission and vision directives. So that's an interesting one, and that's probably a more of a personal one for Active Connections as we stand at the moment. Opening up new markets is just expensive. Developing relationships with new referral pathways, having new staff and new locations, the onboarding costs of all that side of things is really difficult. We're a not-profit. We're a social enterprise, so we have a service fee structure that we charge, but having the ability to gain enough profit level that we can actually look at scaling so we can expand our impact is just a really difficult thing that we constantly evaluating and reevaluating how we can do that to the most effective way. And lastly, and again, this is something that is acutely, well, it's becoming more and more of an acute problem within Ireland, is being able to place a social value on work that we do. We work with lots and lots of people that are dictated by funding, and we're able to show very, very cleanly that, for example, we did an intervention with a young person that had a social return on investment of every €1 that was invested in us, saved the state €29. A very specific piece of work. We were able to really track it through and show exactly what it was. But having that complete field open up in the UK, there's a lovely social value exchange matrix where you can kind of say what interventions generally impact on society as a whole. So being able to bring that back in Ireland and use that as a tool that we can express how beneficial the interventions, how beneficial nature can be to people is something that we're really, really focused on at the moment.
Great, thanks for that, Ray. So a lot in there in terms of, you know, insurance, in terms of liability, in terms of skill set, you know, in terms of measuring impact and value, social value. So covered quite a lot. Good insights there. Thanks a million, Ray. So Lee Marie, we might come to you.
In terms of Wales and our context here, I'm thinking, for example, of my frustration as a practitioner is so if we follow in the 6-week kind of framework program, that can be quite challenging to in terms of continuity. People won't necessarily engage with a 6-week program. They find it difficult. There might be lack of motivation at some point. So that presents challenges in terms of measuring outcomes, for instance, or finding out whether what you're doing, how you're approaching an intervention, how does that work when you don't, with your sample population constantly changes every week. And I think that's something that I've been aware for a bit and other colleagues and practitioners. So we often end up offering quite a lot of drop-in sessions, which are fantastic. But in terms of establishing measures of interventions and outcomes, that can be quite a problem. I think another issue here, I currently work with all charities. They work with funding, and that the uncertainty that fund is going to run off, just disappear in 12 months or 6 months or 19 months, it doesn't help. And that awareness that you might lose that contact with the community after working so hard to establish those networks and partnerships and not knowing whether that would carry on for how long. That's something really affects all of us, because we don't really know for how long that's going to be sustainable. And that's something that I think that should be prioritized really in terms of how to make projects sustainable. And I think in terms of Wales, there's a kind of paradox, because coming from the Caribbean and arriving in Wales at some point in my life, there's tons of nature here and there's lots of different landscape, which is fantastic. But people yet don't engage enough or find it hard to engage. So we have that kind of depth of nature, but people are not really connecting. And partly it's structural. I would say we'll have a serious problems with public transport. It's quite difficult to move around through public links, and it can be very expensive. So for vulnerable groups, including young people, for example, it's almost impossible to access green spaces. And in response to that, we're more aware of, instead of asking people, you need to come to us, we try to move to communities and think creatively about, creating urban gardens, or try to transform your relationship with your own, garden or balcony and all of that. But in the big scale, that's kind of not enough, really. So the issue of access is, I would say, is one of the key things that can be quite frustrating. And because of all the legalities of moving groups around, it's not necessarily that straightforward. And it can add more problems as well, limitations for people to feel that they want to engage with some of the services that have been offered. Yeah.
Great. So many challenges there, Ali Marie. I think in terms of what you mentioned about designing interventions and running, 6-week programs, the dropout rate because of the population you might be engaging, is quite high. So in terms of measuring impact for funding, that could be an issue, and sustainability and ethics around that when you have intense contact with a group of people, and then what's next, I think that's a real issue. So many things. And also, nature as a luxury, a concern that we don't want to create barriers and see nature, nature-based interventions as luxuries for people as well. I think that's very, very important. So thanks, Ali Marie. Micheál?
Yeah, thanks. Similar to Ali Marie, certainly when we're delivering services, I would agree with everything she says, but I think it's a bigger shift as well that's going on. That's a challenge, which is the shift from a sort of traditional medical model to more of a holistic health model. And that just takes time, I think, for people to realize, sometimes both as patient and as medical practitioner, the benefits of these types of services and how important they are for the future for all of us. So I think that's a major challenge that we're always working with. And I think currently for us, it's about meeting demand. I think someone said earlier about this sort of the reality that many of the sort of smaller social enterprises are feeling quite overwhelmed. I even heard it a little bit with just earlier on from some practitioners. And I think that is true, that we're trying to find ways to meet that demand because we feel a passion towards that. And also, we have to then build the networks and communities and create those often from scratch. And that's really important and takes a lot of time as a challenge, and often not paid, voluntary, those types of things. And then the assurance of practitioners and trying to get that on the agenda really strongly. So it's not just about a walk in the park. It's, you know, it's a lot more to it than that, and nature connectedness being seen as something that is an intervention of some sort, and health intervention. So I think that's really important, and service creation models of delivery. I think right now that's where the energy is. Like, how do we do it, and how do we do it well? And, you know, helping to set some sort of standards in that, some understanding through evaluation, etc. And lastly, I think the idea of a profession, that this is a profession that people are called to, that there's a vocational pathway, an educational vocational pathway that begins in school, college as well. And we have been part of setting up some college-based training for younger people to begin to come into this, into green care, and then find their way into, say, trainings or university level training. And I think that whole establishment of it educationally is really fundamental, and a real challenge at the moment as well, to be really seen as part of and funded as part of an educational pathway.
Great. So thanks, Michal. We might just stay with you in terms of opportunities. So I know, you know, we've mentioned, you know, green prescriptions, you know, during the session. And I mean, I know the work you're doing in the UK is really phenomenal in terms of the detail and level you're looking at for nature-based practitioners in terms of ethics and values and theoretical, you know, underpinnings. So what opportunities would you see, I suppose, at the moment and maybe for the future for this work?
Well, I think the opportunities are huge, and I think that's partly, you could feel it in this conference gathering. You know, there's so much potential, and just finding the right way to harness that potential, I think, is, you know, and we will find ways, and we will find our way, and we're still early in that exploration. So I think there's a huge potential for the green care and for nature and health programs to become a standard part of a health system, and I think that's where we want to get to, and for those to be fully commissioned as part of community-based health. And I think there's the beginnings of that with green social prescribing in the UK, which we've been involved with, and we're currently involved in a project here in the Bristol area. And I think that there's a huge interest in it, and there's a generalized big yes to these types of services. And we're finding together, trying to find ways that we can meet that demand. And that feels very exciting. And then also what I really like about this area is that it brings both the health sector and the environmental sector together. So we're really passionate that it's an integrated approach, that it's not about just people, again, sort of extracting being from the natural world, but actually there is a reciprocity, and that there's a giving back as part of, and a, you know, the receiving of something, and how nature and people can recover and flourish together is ultimately our vision and aim. And so that really is exciting, because it brings together two huge amounts of resource. And I think that's a really exciting area to be in, that integrated space. And finally, I just want to say that in discussing you earlier on about group work outdoors, my experience having run groups indoors a lot, and running big trainings and personal development groups and therapy groups, I find working outdoors is so much more easy in some ways and challenging in others. But bringing in the ecological brings something very, very special to our human experience. And I think that that's a really powerful calling back for everyone who can find that nature connectedness. So I think that the opportunity for us to come back to our natural state is there.
Great. Thank you, and so much rich metaphor and symbolism that, you know, we work in partnership with nature outside. So that is always, I always say, I only do a third of the work, the group does a third, I do a third, and nature does the rest. So thanks, Michal. Lee Marie, just in terms of opportunities you might see?
Yeah, I think, you know, some of the things mentioned in the context of Wales and the UK, there's much more emphasis on the social prescribing approach. Part of me saying that's still quite biomedical in some aspects, but I don't want to be negative about it. But I think it's a way forward, because that's kind of the established approach in the UK. So bringing this awareness and way of moving beyond medications and you know. So there's opportunities there for creativity and really for establishing green prescription as a way of supporting local community of practices. I think also it's very important to think about education in the sense that sometimes I feel like I live in this parallel universe with what I do. And I think it's time, we already have tons of evidence that this stuff works. So to become more the mainstream training university in higher education, we have tons of evidence that this is a well-established field. And so I sometimes I feel why we have to create separate degrees or separate trainees. So this could be, we can start embedding this in our trainees already, and or offering micro-credentials for health professionals so they can start linking what they're doing with this kind of work. And I think I'm coming from the sense of we are in a time of emergency. And I can't possibly think of building evidence for the next 5-10 years when I know, we don't have that time in a way. And I think also something that I really enjoy about this work is this is a truly transdisciplinary practice. This is no single discipline on this. So this really is really important to collaborate, to have conversations with different partners and colleagues, and really expose yourself to different kind of knowledge, including indigenous knowledge, obviously, different kind of narrative. So I find that very exciting, and the potential for creativity and insight is tremendous. So definitely something to be excited for about.
Great, thanks, Marie. And I think it's about taking a risk as well and moving away from those traditional systems that sometimes we get caught in. So, so thanks for that, Ray.
Yeah, so I apologies, I raised lots of barriers, but thankfully I'm hugely optimistic about where we are. This world of Zoom that we live in is lovely and safe in a COVID time, but so is the outdoors, and I love spreading that message, and spreading that message as much as we can. So we, in 2019, started working far more intentionally with young people that had additional, so young people with autism, young people that had Down syndrome, young people that had dyspraxia. And we started a really small little program that has grown and grown and grown. And we, half of our company now is built around this beautiful service where we're working with these young people with additional needs, helping, supporting their families, making sure that the whole holistic view of it is that these lovely people are getting the support. And as you said, the nature is doing a huge amount of the work for us. We're giving young people this amazing environment to go play and be interacting, socially connected, and all that loveliness. So that program just last year grew by 300%. So incredible opportunity right across the board. Young people with additional needs are some of the least served participants in most population bases around the world. So I definitely encourage people to look at that. It's so good. Our adventure therapy service has grown 10% year on year, and thankfully we're very good at what we do and being able to explain that. So I love the fact that I'm able to spread the joy of bringing young people that have emotional difficulty, have behavioral regulatory problems, that into the outdoors. And it's just this lovely environment where people regulate and just get so much out of it. Another area that we're focusing quite a huge amount on is around social procurement. How we as practitioners can sell to the state, can sell to local authorities, can sell our well-being program, augmenting what they have within their very medicalized, whether it is traditional counseling, equine therapy, whatever it may be, that we're bringing that back and putting it very much on the plate and on the forefront of the procurers. So we're not going after private agencies. We're actually going back to our health procurers, our social work teams, saying, you have a well-being program within your agency. Can we access that? Can we support you in what you've experienced through this COVID time? Can we take you to the doors where we know the benefits that you're going to be? And therefore it becomes a very much a live option within the people that are going to start using it on a menu of options for their own clientele. So we're very much pushing it from the bottom. We're also speaking a lot to and putting so in most European countries, and I'm assuming it's around the world, a lot of governments have a clause around a social value clause in their procurement approaches. So if you can leverage that a little bit to show we can do fantastic work here, expose you to what we can do, but also you can then cascade that back down the way towards your colleagues and so on like that. I just feel that there's such an immense amount of potential there that it's just open, and it's never been so open before. Great,
thanks for that, Ray. So a lot of work done to be done, but sounds like many opportunities there, especially with young people with additional needs. Nevin, last but not least in terms of this question.
I'm just full of hope for all these great answers I've heard. But I think I would also echo what everybody has already said in terms of opportunities and the positives. And one thing that comes to mind in the last 2 years is that within our practices locally, prior to COVID, we had some difficulty convincing practitioners of all stripes, whether they were in social work or counseling or psychologists, about the notion and benefits of moving their practice outdoors. And then suddenly they were asked to like clean chairs and door handles and so forth with COVID. And so we suddenly, became popular in terms of the trainings and this idea that moving practices outdoors it's easier and it's more efficient and there's less concern about, viral transmission, and all of that created an opportunity for us. We were only on Zoom for maybe 6 weeks. Our practice was office-based for only about 6 weeks until we figured out how we could meet all those health orders. And we kept our practice outdoors throughout the entire time. Because we were deemed essential services as mental health practitioners, there was no closures, there was no lockdowns. It was, the community was, which created crisis, but the practitioners weren't, because they were creating care and positive outcomes. And so I think that movement towards bringing other practitioners outdoors and being interdisciplinary, as Anne-Marie said, has great potential. And one of the things that I've noticed in, say, I'm going to back up because Shirley, you and I met a long time ago in the adventure therapy world. This movement towards definitions, like what is adventure therapy? And it became this 15-year conversation that really wasn't that important, especially at the international level. Regionally, sure, you need to convince a funder, an insurer, a legislator, like this is what we are and this is how we define it. Great. For the sake of my practice, I call it this. This is how we do it. On a grander scale, that movement towards finite definitions and practices for me is becoming untenable. Last project we did last year was to look at outdoor therapies from a very broad lens and say, what are the commonalities between the equine therapist, the animal assist, the surf therapist, forest, nature, adventure, wilderness. It goes on and on. Our Indigenous colleagues doing like land-based Indigenous resurgence camps and so forth. They're all place-based, they're outdoors. We're all kinesthetically engaged, bodily engaged in some way. And there's some level of kinship with nature. And around those three pieces, I think many practices can find their place. And we remove the walls and we remove the institutions. And then we're kind of operating in a more ancestral way, which could be recreation, education, could be therapy, but we even need to call it outdoors anymore. We don't need to call it nature anymore. It's just maybe the place that we're supposed to be doing this work. I know there's been a drum in the past around this like transcendence of nature, like the romantic, and Christian versions of what it is in nature. And in fact, the more time I spend with practitioners learning about how to be with their clients outdoors or how to run programs outdoors, you get a sense in their feedback that this is maybe just the way it's supposed to be. So maybe transcendence is actually just what the human experience is supposed to feel like. And that would be in the natural environment as opposed to the artificial environments that we find ourselves sitting in and, again, talking into. So the opportunities for me are great because they're a return to that, reciprocal relation that Michal was mentioning in terms of it's not a dichotomy humans and nature. It's just, we're all nature, and this is the right place for us to be. And that's why these things have educational and therapeutic values attached to them.
So thanks for that, Nevin. And just removing silos as well within green care, within nature-based solutions, I think is a really important aspect. I'm just conscious of time, and we want to leave time for questions. So maybe if you could sum up in 3 words in terms of supports. So what supports do you think this area of nature-based practitioners, nature-based solutions for health and well-being requires? So we can keep it down to 3 words, and then we'll go to the questions. So whoever wants to start, I won't put you on the spot.
Maybe I'll just put out, and this sounds clinical, but like the specificity of what we're doing is fairly unsophisticated. I'm saying that for my own practice, that yes, I'm trained as a clinical counselor. Yes, I'm an outdoor educator for my career. But at the same time, when someone says specifically, I'm dealing with issue X and I have these indications, the matching of the nature-based practices to me are fairly unsophisticated. I know there's a lot of work going on around the world, but I think there's a need to bring that together to justify some of the things that we're doing.
Great. Thanks for that, Nevin. Anyone else? Ray?
Sure. Money, marketing, and training. There you go.
Great. Thanks, Ray. It's pretty straightforward. Michal, maybe?
Yeah, I would just add to that standards and accreditation to help us all, and training, money also there for me as well.
Great. So training, money, standards. Thanks, Michal. Lee Marie?
Kind of similar, really. So I'm not sure if I can just say 3 words, but I was thinking, thinking funding outside the box, thinking creatively about research methodologies that really capture complexity. Nora Baton talks about warm data, so I'll leave it with that, something like that.
Great, thanks, Lee Marie. So fascinating discussion. So we might, I think, Ricardo, are you going to share the Slido screen?
Yes, absolutely.
Brilliant.
As we have several questions to all the panelists and some specific questions. See here, Charlie, the first 3 questions. So
Sure.
I share the screen.
Great. So lots of interventions are focused on particular demographic. How can we encourage? Okay, so I might ask Nina's question to Ray. Ray, so what is your experience combining skill sets, knowledge, practitioners working in duos or teams?
Broad. What we've done first for our own team is find the best people that we can possibly do needs analysis and fill in all the blank around as best as possible. Is the simplest, shortest answer that I could possibly do. Yeah.
Fantastic, Ray. And maybe we will ask this to Michal. So Michal, lots of interventions are focused on a particular demographic, like the elderly. How can we encourage interdemographics to build community cohesion?
Well, I mean, some of the work we're involved with a lot is around sort of spaces, natural spaces becoming the center for community. So therefore, there's a natural process of everyone in the community coming into that space and finding ways that they can integrate the community development and also their health being through care for the green space. So it sort of comes to that other question there about how do we care, green for care or care for green, and actually that again reciprocal process that these green spaces become really profound assets for people personally and as a community.
Great, thanks for that, Michal. And we might ask Lee Marie, just a question from Ants. What about the learning curves needed by practitioners and clients on the possible impacts on nature? So not just Green4C, Green for Care, but also Care for Green.
Yeah, I think in Wales, there's more awareness of particular learning outcomes for both practitioners but also educating clients about how these different approaches are, because they're framed as new interventions, although we know they're not that So there's an element of bridging together perceptions and understanding around how to work and what are the expectations as well, particularly from clients' point of view. And I think sometimes there's apprehension, how would that work? Because people are not necessarily used to these approaches. And I'm aware as well that there's a partnership currently in Wales where we've tried to put together standards of practice for nature-based practitioners. So hopefully that also encourage looking for more universal standards of practice, although that sometimes comes with some limitations as well, but that would be specifically for Wales at the moment.
Great, thanks Lee-Marie. And just finally, we have a question for Nevin. What do you think are the key mechanisms of change with clients? So it's always a very interesting one, isn't it?
Yes.
Yeah.
Well, for those who read the research, we just recently published an umbrella study, which is it's a systematic review of the systematic reviews of outdoor therapies. And we were looking specifically for descriptions of like the therapeutic change models or mechanisms of change. In terms of like the A causes B type research, we have plenty of theory. We have plenty of practitioners who are able to conceptualize and describe some of those linkages, but there isn't really a lot of research that specifically says A causes B in outdoor therapies. That said, I'm still a strong believer that the common factors in therapy apply to nature-based approaches. So, you know, our showing up and being authentic with our clients and building strong alliances and relationships is the best that we can do. The client's level of hope or belief in change in themselves is the best that they can show up with. And then nature, I think it's the health factors. I think it's the quality of experience and the ways in which nature can become the co-therapist in terms of assisting with developing sensory awareness, self-awareness, self and co-regulation. Our capacity to work with our autonomic nervous system in the outdoors is so much easier. And I think there's some great indicators there, mechanisms that we can show that that nature itself in the right context, of course, under the right conditions and preferential environments can be a great regulator for our well-being.
Fantastic, Nevin. So great discussion, I think, and great insights from all the different practitioners. And I think it's, you know, we can see parts obviously with the market outlooks from Green4C in relation to, you know, standards required, you know, certification, training, funding, and also the area for nature-based solutions for health and well-being, you know, in terms of standards, but also in terms of sustainable nature-based enterprise. So I think if any of you want to join nature-based enterprise platform from Connecting Nature, there'll be a link below because we're trying to promote the work of nature-based enterprises that are sustainable, that are ethical, that are professional, and I think we need all that support. So thank you so much to all the panelists for today's discussion. I learned myself, and hopefully the members of the public thought it was engaging and interesting. And I'll hand it over to Davide now just to finish and to sum up. So thank you, everybody.
Thanks a lot. Thanks a lot, Shirley. Can you hear me? Yes. So my responsibility is to thanking, of course, all participants and speakers and the moderators. Let me also thank all the people, the staff that was behind the scene, behind our work, maybe not visible, they maybe now become visible at the end, that are, of course, not only Colm, that you have seen, and Riccardo, but Georgia, Ainur, Ilaria. Thanks a lot. And some technical questions. We will, of course, make available all the PowerPoint presentation on the website of the Green4C project, but there you will find also information about all the publication and the platform that we were mentioning during the meeting. You will also find other interesting material, like, for example, information about the Green4C Alliance. That is a nice network that can be useful also for maintaining contacts and links among all us. You will find also some answer of the question that have been posed and that we have not been able to answer. So have a look to this website. And finally, 2 points that I bring home as a good lesson learned. Well, first, let me share the optimism of many speakers. Really, it's difficult to organize a meeting where the attitude of person so positive and so optimistic. It's nice. And that is even more difficult when you put together people with a very different background. We have seen people with a background in health and medical care techniques, and people with a background in management of environmental resources. This is the strength of our way of working. And that is reinforcing our optimism. But as a lesson to be learned, I think, as mentioned by some of the speakers, we need to share the impacts of our activity. Impact assessment is a key need for keeping the interest and the activity and the economic investments in this sector, sharing the positive elements deriving from our activity from different point of view. Of course, starting from human health, but I would like also to stress the point of the positive impacts assumed in a critical way also on environmental resources. We run the risk of creating negative externalities to natural resources, environmental resources. But all in all, I think that we have a lot of green areas that are available, that can be supported, can be protected, thanks to increased interest by society. I'm coming from Southern Europe. We are facing the problem of increasing the forest cover. Our forest cover in our country is Italy, but the same in other countries has doubled in the last 50 years. We have a problem of abandonment. We have a problem of forest fires. We have a problem of degradation. Making intelligent use of these areas for green care activities help to have people informed about the benefits that can derive from protecting these natural resources. And finally, the last point is about the financial matters. Here, unfortunately, I'm speaking from taking into consideration my professional background, that is that one of an economist. I think we have an element of strength that we have to make public in a very clear way. Green4Care solutions are efficient. They are efficient not only, as I already mentioned, for protecting natural resources, but are efficient for helping society to keep with all the negative impact of urbanization and modern life. They are a very efficient system for mental treatments, for social inclusion. And that is a message that has to be clearly given to policymakers. And our advocacy activity, that is a fundamental importance, should really rely on these 2 points. We have an interdisciplinary scientific approach in measuring impacts, and among the impacts, the financial impacts are of great importance. Okay, with these 2 messages, I thank you all for your participation, active participation also through Slido. And I only invite you to keep this attitude, positive attitude of sharing experience, of networking, and stay together. With that, I thank you all again. And
Davide, we want you to take a picture to all the panelists and experts.
Okay.
So I ask you to switch on your webcam. Thank you. So I ask also to Matt, Gerard, Ilaria. Okay, so thank you. You can smile. Thank you so much.
Thanks to you. Bye-bye.
Bye-bye.
Bye-bye. Thank you, everyone.
Bye.
Thank you. Bye-bye.
Thank you.
Bye.